Hey, welcome back to the program. As we continue on this program to battle back against junk science and junk medical information, I was really alarmed to see a story yesterday. I guess I shouldn't have been surprised. A lot of people weren't surprised. Had already encountered this in the medical field. But it was a story yesterday about people who smoke and use nicotine being denied surgeries. And it was the examples that they were using, and I'm not sure how many different types of surgeries or what, but the examples that they were using were osteosurgery, so back surgery, neck surgery, stuff like that. And it was, the article presented it like it was just no big thing. It was no problem. So I posted this up on Facebook, and I had people actually trying to make the claim that even if you use just nicotine replacement, that the nicotine is going to mean you can't heal and you're going to be denied surgery. And I was told by one person it would be malpractice to operate on somebody who used nicotine. So immediately, I email my pal, Jeff Stier at the National Center for Public Policy Research. And lo and behold, you have some interesting stories to share about more junk medical information that's being put out there.
Absolutely, Vicki. Thanks for having me on.
My pleasure.
One doctor I spoke with today told me that, and he's an expert in nicotine, told me that the malpractice would be not doing the surgery because it's inhumane and it's based on junk science or a misunderstanding of the science that nicotine potentially could be the problem at high doses before surgery. But I'm sorry, that the combustion of the cigarette is the real danger, and that it's ideal to get off nicotine a day or two before the surgery because it does take 24 hours or so to clear your system. But the idea that a vapor can't have surgery is preposterous and not based in science. But it shouldn't be a surprise because the United States Department of Defense is sponsoring a program called You Can Quit Too, the letter U. And they have a phone number that you can call into and ask questions. So you can say, well, I'm a smoker and I have a hard time quitting. Would it be less harmful for me to use an e-cigarette? And they will tell you, based on the script that they've been advised, that both are harmful. So you could say, well, thank you. I don't want to take on any more risks, but I can't quit smoking. Is one less harmful than the other? Well, they both have risks, the Department of Defense official will tell you. And they go on, and they will not tell consumers the truth, which is there are different risks. One is extremely high and one is extremely low. You can ask them, what about using smokeless tobacco like snus, which they use in Sweden, and the science is quite clear that you don't have the health effects from smoking when you use snus, and the risks are dramatically, exceedingly low. And if you're a consumer in the U.S. and you ask that to this federally funded program, You Can Quit Too, they will not tell you the truth. And the transcripts are now being published online. People who call in and ask these questions, you can do it yourself and say, if I use a non-combustible tobacco product, will I reduce my risk? They will say, well, both products have risks. All tobacco products, all nicotine products have risks, and you should quit using any of them. And you can say, well, yeah, that would be ideal. But if I have a hard time quitting, and it's like they go in circles, and they do everything possible to avoid telling the public the truth.
Why? Because the science is clear. Let's say the science is exceedingly clear on smokeless tobacco, things like snus, smokeless tobacco, or just nicotine replacement products. They don't necessarily help you quit as easily as an e-cigarette, but on those products, they're they're almost they're very close to harmless. So e-cigarettes have now got an abundance of data that is piling up that strongly suggests the exact same thing about them. And yet, when you call a quit line, you're told that smoking and using a smokeless product or using a vapor product is equally dangerous, which is a
when
lie.
You try to nail them down and ask them, is it equally? They will say to you, well, they both have different risks. And you say, I understand that. I understand that they have different risks, but because I'm not able to stop using nicotine or I choose not to, and I want to lower my risk, would my risk be lower if I used a non-combustible product? And they will tell you, they both have risks. It's literally like you're talking to a machine.
Okay.
And you have to have some, I read lots of these transcripts of people calling in, and they've been sharing them. And you almost have to have a little bit of sympathy for the people taking those calls who are forced to give certain answers, because they're basically being forced to...
They're using a script.
To lie. Yeah, but really, part of me felt bad for these people who are taking these calls. But if you think about it, you really ought to feel bad for consumers who actually rely on the government for information, for accurate information, because their lives are at risk. So those are the ones that I feel bad for.
But now medical professionals who ought to know better are saying things like, and I shared with you a post on Facebook that I got yesterday from somebody who claimed to be a medical professional, who claimed that it would be malpractice to perform an operation on somebody who used nicotine. And said explicitly in the post, it's not just smoking. It's the nicotine. That's just simply wrong. There's no science to support that statement. And then claimed it would be malpractice to operate on somebody who used nicotine. And I thought to myself, this person is supposedly a medical professional. And so that really, it's one thing if the government does it. And, the quit lines, that bothers me. But you've got medical professionals now, and we both saw that article yesterday, making the claim that health care can be denied from people, even people who do quit smoking, but don't quit nicotine.
That's absolutely right. And I would
based
argue
on junk science.
And I would argue that it's inhumane and that it's malpractice not to provide patients medically justified care that they need for a reason that has nothing to do with how well you will heal. And certainly, it's as you've said, it's not optimal to be a nicotine user and go into surgery. But if you have pain, I would argue it's not optimal to live the rest of your life with pain.
But if you're a nicotine user and you go into surgery and then a doctor says, listen, I need you to go off nicotine for 48 hours. Everybody can do that. I haven't met even the most hardcore smoker who can't do that. So, okay, so 48 hours. Yeah, because then whatever, because it acts on your body like caffeine does, or maybe even an antihistamine, maybe in some ways. It has a vascular effect. So,
exactly.
Yeah, all right.
You ought not to be having lots of caffeine before.
They tell you not to drink coffee.
Either.
Absolutely, they tell you that.
But could you imagine if they said to you, if you are a coffee drinker, if you are a soda drinker, you can't have surgery?
It'd be stupid.
It's obnoxiously absurd.
No, and they also, by the way, I should point out, they don't test you when you go in for a procedure, an anesthetic procedure, and say, have you had coffee? And you can say, no. And they don't take blood and say, I don't know. There's caffeine. We're getting some trace caffeine here. Going to have to put off your surgery. They never do that. And yet now the new thing is to test for nicotine markers to determine whether or not you smoke or don't smoke, when that isn't an accurate determination of whether you smoke or don't smoke.
Exactly.
This is appalling.
To think about it this way, you should be able to rely not only on the government to provide honest information, but more so, you should rely on your own physician who you're trusting to do surgery on you, to have that surgery guided by scientific information. But I think the pervasiveness of the abstinence-only approach has begun to infect the minds of doctors as well.
It has, and I recall talking with my mother's oncologist, and after he had told my mother that my switch to e-cigarettes was just as bad, if not worse, is what he had said to my mother, than smoking. And my mom, of course, she had lung cancer. She's panicking for me, and I had to say, I'm sitting down with a doctor, and I'm setting his mind right on this. And at least he agreed to look it up when I was done with him. But geez, Jeff, I mean, he's an oncologist, really, for crying out loud.
It's sensational, and it's important that we hold those accountable, those who put out this misinformation that are driven by ideology, driven by who knows what.
Well, I'm telling you what, this man wasn't. This doctor
financial ties to the pharmaceutical industry.
Yeah, but this doctor wasn't driven by ideology. He was driven by bad information. He had, read medical journals or WebMD magazine or whatever.
But Vicki, my point is that the activists who are on the other side of this issue are the ones that are driving that misinformation that is filtering down to doctors who are well-intentioned, who are not specialists in this area. They look at something from the American Heart Association, the American Lung Association, American Cancer Society. They see these groups, which are driven by activists, saying negative things about harm reduction, and that misinformation filters down to real people and real patients and their doctors.
You know, Jeff, as I'm looking and we're talking here, I had caught this story today, and I'm not sure you saw this. It may be an old story to you, but it was a question that was posed to inspectors general about how much fake data and junk science is funded by the federal government. And they couldn't answer the question. Although 2 years ago, there was somewhere in the neighborhood of $7 billion canceled based on phony data or bad science. So that's a bad sign.
It's really hard to figure out how much of it there is, because it's not only done by federal agencies like the Department of Health and Human Services, which I know now has better leadership through the Centers for Disease Control, but also from grants that they give to people like Stan Glantz in California, who gets federal research money to promote the bad science that gets out there. And that's why I'm optimistic about today's news, that the president signed an executive order calling for more regulatory reform, actually putting what it seems to look like at this early stage is there are going to be task forces in each agency that will be required to make sure that these regulations are not an undue burden. We saw on issues like the FDA's deeming regulations on e-cigarettes, it had to go to OMB, the Office of Management and Budget, who has a division called OIRA, the Office of Information and Regulatory Affairs, which takes a closer look at regulations. Well, it looks like from the news that just broke a few minutes ago that the president is basically putting OIRA on steroids and sending them into each agency to keep a closer eye on them. So I think that's going to be some good news, but still we're going to need clawbacks on the Obama administration regulations.
Absolutely, because
where OIRA didn't do enough.
Here's what seems to have happened, and I've talked with Pat Michaels on the global warming stuff, and from the same, it has the same problem, is
Same
that
thing.
federal dollars flow into universities, but those federal dollars intend to get that university to generate research justifying whoever gave the money to the federal government in the first place, whatever outcome they want. So if the outcome is all of these people are getting hooked on opioids and we should never prescribe opioids, then that's what they're going to generate in terms of data. If it's that global warming exists, then that's what they're going to generate in terms of data. It's go out there and give me a study. I don't care what you have to do to say that e-cigarettes are dangerous or snus are dangerous or whatever. Then go out and do that. Here's federal money to the university to generate that. And you're right. So they can say, well, it wasn't us. It was the University of Washington.
And we've got more money budgeted for you for next year if you do it right.
Exactly. And that's how the federal grants keep flowing in. You give us what we want, we're going to keep giving you more federal dollars. Just keep generating the kind of information we want. The EPA has been doing this on air quality standards and all kinds of different things for years and years. We should have never allowed the commingling of federal interests and science from the beginning. And I don't know how you unwind it.
No, and it really goes through every aspect of the agency of each agency in how they manipulate the public and how they manipulate science. Certainly, there's a news story today about the president and keeping certain media out of the gaggle today. Well, were the people who are complaining about that, were they as upset about 2 years ago when the Food and Drug Administration was caught doing something arguably worse, which was they actually gave embargoed news releases to media, major media, before this regulation came out, before the science came out, before whatever it was came out, and said, we'll give it to you, Washington Post, if you agree not to call experts who disagree with us. And they had to agree in writing to do that, or they wouldn't get the story. And it was a way that the Obama administration was using the power of the government to control the story. And the people who are, I think, reasonably complaining about what happened today at the White House, those people were, by and large, silent when the Obama administration, throughout a variety of agencies, specifically the FDA, were doing the exact same thing, arguably worse, because the effort to manipulate the story and deny reporters the ability to get expert opinions or be told you won't get the story until everyone else has it already and has published it once we lift the embargo, then why weren't these people who are upset today upset then? It tells me that it's driven not by an effort to have transparency, not an effort to get a good story out, but it's driven by media bias.
Oh, absolutely. Ideology, a political agenda, and it ain't over. This is going to be a long, hard slog, but at least to your point about Health and Human Services, at least it appears we've got, whatever you think about Trump, what his selections for his cabinet positions, particularly with Health and Human Services, with EPA, and I'm hearing the same about FDA. He's picking people who believe in science, who believe in data, who believe in the truth, and I think that's a good sign.
It's a step in the right direction.
Great to have you on the program. Thanks as always. Jeff Stier from the National Center for Public Policy Research. And I should also point out, if you want to find Jeff on Twitter, because it's loads of fun to watch him go to war with the junk science people, it's Jeff A. Stier, Stier, on Twitter. We'll be right back.